A growing number of Americans are losing confidence in hopes of a safe coronavirus vaccine. A new study in the Lancet Medical Journal found that vaccine confidence is going down because of misinformation online and political polarization. NBC News senior medical correspondent Dr. John Torres joins us now. Dr. John, good to see you. So first, let's talk about this study. How are people's views about a vaccine being impacted?
And Joe, you're absolutely right that people's opinions of the vaccine and especially its safety are going down. And we're getting a lot of what we call this vaccine hesitancy out there. And part of the issue is because of the politicization of the vaccine itself. You know, the fact that it's getting talked about a lot about it being delivered in October, it being delivered in November, you know, how they're going to distribute it, those types of issues. People are hearing that. But also they're seeing on social media a lot of misinformation about the vaccine and how it's being developed and why it's being developed. And then it doesn't help matters that we hear about the Russian vaccine that's getting approved by Russia, but it hasn't gone through phase 3 trials. And so you can understand why people are a little hesitant as to saying, okay, are we making sure this vaccine is safe? Because the vaccine seems to be very rushed at this point. But if you look at vaccines and how they're produced, they're actually doing a great job of getting it produced quickly with safety in mind. I think that's the main thing people need to understand, Joe.
Yeah, so what is your advice to those who are hearing all of this? They don't want to get a vaccine because they're concerned about the safety.
I think my main advice is just to follow the news and what goes on over the next couple of months. Like a few months ago, we heard about the vaccine, possibly as early, even a few weeks ago, early as October. And then they started saying November. I talked to actually Dr. Francis Collins yesterday, and he said, we're looking at maybe at the end of the year for one vaccine. And you've also heard the news about that one patient who came down with a condition called transverse myelitis, and the fact they put a halt to the whole trial until they find out if that was vaccine related and what that particularly means for going forward. So that's pushing safety out to the forefront. So keep an eye on that, keep an eye on the data, and particularly keep an eye on who gets that data. In other words, how transparent all the companies are getting that data out there so that independent researchers can look at it. Researchers that basically don't have any horse in the race, who don't have any reason to approve it just for financial purposes, they can look at it, they can give the rest of us information on what they think at that point. And if it looks good, then we can push forward with it, Joe.
All right, good advice, Dr. John. Thanks so much.
You bet.
New York City will resume indoor dining at restaurants later this month. The move comes as the CDC suggests eating out may put people at higher risk for COVID-19. NBC News correspondent Tom Costello reports.
Yeah, good day. As you know, restaurants around the country have been decimated. Here's what they're doing in Bethesda, Maryland, and in many cities around the country. They've closed down the street outside so that the restaurants can bring their tables outside. People can eat and drink and be socially distant. It's worked great. But what do you do when the weather turns cooler and people want to go back inside? How do you keep them safe?
Order up. A growing number of restaurants across the country are now trying to rebound, slowly welcoming customers back inside.
It's been a roller coaster of emotions for all of us in the industry.
Fiorella Blanco of Vista Miami says things have greatly improved in recent months. And while they're still navigating the ever-changing new normal, customers are returning.
When they see that there's enough spacing in between tables, our staff all wear masks and gloves, so I think that they feel pretty safe.
But as more people decide to dine in, there are new concerns about increased risks for COVID-19. New research from the CDC looked at hundreds of people with coronavirus symptoms and found those who tested positive were about twice as likely to have reported dining at a restaurant in the 2 weeks before they got sick, although the study did not differentiate between indoor and outdoor dining.
What is it about a restaurant or a bar environment that might put people at greater risk?
What we're learning about this virus are the factors that you see in a restaurant put you at higher risk. No mask, time indoors, a lot of people, low ventilation. That's when outbreaks occur.
Experts say when it comes to indoor dining, airflow is key, especially since people are unable to wear masks while eating and drinking.
In many restaurants, you might have an air conditioner that's only recirculating air and no filtration. And that will allow a buildup of airborne viral particles.
Dr. Joseph Allen with Harvard School of Public Health says the key is circulating in fresh air from the outside and ensuring that air isn't just blowing in one direction, potentially transmitting particles from an infected person to someone at a table downwind.
1, 2, 3.
Soon, New York City will start to allow some indoor dining at 25% capacity. But in the Big Apple and other major cities, space comes at a premium.
But this is how B&H look inside.
And some restaurants are still trying to figure out how to safely let people back in. Down in Miami, where things are slowly getting back to normal, concerns about what another spike could do.
It would be devastating. In another shutdown, I do not foresee the industry making it.
So you see the developments there in Miami. News out of Florida. They are now going to allow restaurants to reopen, but at 50% capacity. And that decision comes on the same day that they announced 200 deaths on Thursday from COVID, and that's the highest in 3 weeks.
Coronavirus cases are spiking at Illinois State University, the campus reporting more than 1,000 infections since classes resumed last month. This is video from a party near the university earlier this week. You can see there's no social distancing and no masks. That party now under investigation. Here's NBC News correspondent Ellison Barber.
As of this morning, the university has over 1,300 confirmed cases of COVID-19. The positivity rate, 9%. And there's concern among officials here that that number could rise. Videos surfaced on social media this week of a massive party. It was reportedly hosted, at least in part, by popular YouTubers who posted videos of the party on Instagram with the location tagged to ISU. The university says the party took place off campus, but they're now investigating it. They say they're working to identify students in the video, and if they identify people, there will be disciplinary action. The school's president chastised students for attending parties in a speech this week.
The activity of some have contributed to the significant rise in coronavirus cases in our community. Some of you have been called upon to answer for your actions and face more stringent penalties if cavalier behavior continues. Penalties that could jeopardize your standing at the university.
We spoke to one ISU student who's been battling COVID-19 on her own at her apartment off campus. She says when she saw videos of those large parties earlier this week, her mouth just dropped to the floor.
Especially having it and knowing how terrible it is to have all these symptoms, have all of this worry, this stress, being in a town that isn't even my hometown and worried about the people who live in Normal that have to see us at the grocery store or deal with us in transportation and in the coffee stores. We are just putting so many people at risk by letting students act that way. And I can't believe it.
The mayor of Normal already banned gatherings of 10 or more in areas located around the ISU campus. Joe?
Hey, NBC News fans, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.